Good morning, everyone, and welcome to Chamber Connects. Just so you all remember, we're recording this morning's program and we're going to post it for viewing on our YouTube channel a little bit later on this morning. This morning, we're connecting with one of our new state senators, Peter Oberacker. Senator Oberacker is serving his first term as senator for the 51st New York State Senate District that includes parts of 9 counties from the Hudson Valley to the Finger Lakes. In Delaware County, he represents the towns of Sidney, Franklin, Davenport, Meredith, Courtright, Stamford, Roxbury, Middletown, Andes, and Bovina. How am I doing, Senator? So far, so good?
You're right on, Ray.
He's the ranking member of the Senate Committees on Internet and Technology, as well as Alcoholism and Substance Abuse. Senator Oberacker is also a member of the Education, Higher Education, Judiciary, and Health Committees. And just to remind you, if you have any questions for the senator, please post them over in the chat box. Lillian is monitoring all those comments, and we'll ask those questions a little bit later on in the program. Lillian's also going to post the senator's email address in the chat area, so you can get in contact with him and his staff. Let's just start with one question for the senator this morning. Senator, you recently advanced an amendment on the floor of the New York State Senate to rescind the governor's emergency executive powers. Why do you think such an action is necessary?
Well, good morning, Ray, and thank you for having me on today. It is a pleasure to talk to you again and to our folks from the chamber. How long do we have? Moving in a linear fashion and in a thought process. There isn't any of us that at the beginning in the onset of the pandemic felt that wasn't a good move. In other words, I mean, we didn't know what to expect. Decisions needed to be made quickly, and so in the beginning of the pandemic and this process, no issues whatsoever with that being those powers given to the governor. I think we can all say now at a certain point there has to be a sunset clause, and I think we've reached it. And myself, along with my Senate Republicans, have asked for these powers to be rescinded. In fact, I was the 14th senator to go on the floor and to ask of it. And in light of where we are today, I think we can all agree that we've hit the appropriate time to have our co-equal branches of the legislature working for the people. And I'm looking forward to this next week. I think it will be a very interesting and engaging week, I'm sure. So,
well, we're going to return to the senator in just a few minutes with some more of your questions. But first, let me tell everyone here give you some news from the Delaware County Chamber. A couple of events and programs that are coming up over the next few weeks. I just want to remind you of. You've seen a lot of these in our newsletter, our weekly newsletter. One is our Leaderful Delaware Emerging Leaders Program. Applications are still being accepted. We start those virtual classes on March 16th. There'll be 2 sessions every month, 2 afternoons a month, the 3rd and 4th Tuesday, and that program will run about 8 months. Also, our 4 Weeks to Launch program. That's a new partnership that we have with our friends at the DCMO BOCES. It's part of their new Entrepreneur Academy. Virtual and in-person facilitated program starts in just a couple weeks on March 2nd. And also our Priorities for Action 2021. Earlier this week, the Chamber Board of Directors approved our Priorities for Action strategic plan for 2021. And it lays out what we expect to accomplish this year in 5 very broad areas, including advocacy for policies to build and grow business, community and economic development, business training, mentoring, and counseling, population recovery. That's one I'm particularly excited about what we have planned. And finally, fifth one, creating connections and value for our members, which is what the chamber really is all about. With all this, and finally this morning, one last bit of news, or maybe a plea. I think everyone on the call is already a member of the Delaware County Chamber, but if you have some business colleagues who are not members, who organizations are not members of the chamber, I encourage you to encourage them to join the chamber. With all the news coming out about the PPP, EIDL, and all this information, having reliable and accurate information that you can use for your business or their business really has never been more important. And the chamber, as we've proven over this past year, especially, is your one source for assistance, ideas, inspiration, and most of all, the facts. So if you know someone who's not already a member, encourage them to do so. Membership really is an investment in their business every single day. And information about membership, chamber news, registration for all the events are located at, of course, where else? DelawareCounty.org. And we rely on your continued support, both your attendance at events like this and your financial support to carry out the mission of supporting businesses in Delaware County. Event sponsorship allows us to create these opportunities to learn and to engage with regional leaders like Senator Oberacker. SFCU is sponsoring today's program, and I thank them for their continued support. I'm happy to introduce to you the FFCU CEO and also Chamber Director, Jim Reynolds, who's going to give us a brief update on what's happening at Sydney Federal Credit Union. Good morning, Jim.
Good morning, Ray. Thank you, and welcome, Senator, and every attendee here today. So first of all, I do want to thank Ray and Lillian for their tireless efforts promoting business in Delaware County. We're very fortunate to have them representing us. Second, I had the pleasure of meeting the senator about 4 weeks ago now in Sydney, and I'm really excited about the passion he's going to bring and the leadership at the state level. So welcome, Senator.
Thank you.
Finally, just a quick overview on the credit union. So yeah, very fortunate to be able to represent today's event. And so we're 56,000 members strong financial cooperative, and we've got a voluntary board of directors, 170 employees that are member focused, and really the key operative word in all this is member. So that's really what we're all about. We strive to take care of our members, do what's best for them. We were on a very aggressive growth projection here in the next few years, so we've got a lot of initiatives coming down the line. But at the end of the day, it's about trying to make banking easier for our members. And so we not only serve individuals, but also businesses. So I want to emphasize that. Sometimes I don't think that's clearly communicated within the credit union industry that they actually serve businesses as well. So we have a lot of opportunities ahead of us in that area. Very strong lender, and we have 9 branches going on 10, but a very strong presence, obviously, in Delaware County. And I think one of a big focus this year for us in trying to differentiate ourselves and help our communities is really financial education. So that's going to be a major initiative for us, financial literacy, bringing that into the schools as best we can, and now to the adults as well. So got a lot of great process and progress moving forward right now. So we're excited about the future. And again, thanks for letting us sponsor today's event.
Wow, we always appreciate sponsorship. So thanks for joining us this morning, Jim. Let me bring Senator Oberacker back into the conversation. Senator, you entered office at a very difficult time, obviously. What are some of your priorities as state senator for the 51st district?
Yeah, I had a good friend of mine, Ray, say, he says, your timing is impeccable. Even if you could run during a pandemic. And so, we really are charting some new territory in the way that any of us in a public office, reach out to our constituents and especially in this time. So absolutely agree. Some of my priorities, first and foremost, being the ranker member on the internet and technologies is broadband and cell service. Now I'm actually kind of teaming up, the dual concept because I really believe the challenges with getting broadband to everyone, which should be our ultimate goal, is going to take a hybrid approach of where we can team up cell and landline, if you will, or the fiber optic lines coming in. So that's still my priority number one. And I had a great meeting with our Congressman Delgado, and basically I said, how can I help? Let's really have this conversation with some signposts, with some metrics in mind to accomplish some of these goals and move forward. And it again will be a huge effort, but one that I can speak personally to because I don't have it so at my home. So I think that's number one. Again, being on these committees, education and health. And actually, I think both are really intertwined, Ray, at the moment. I think getting our education back to full strength, back to in-school learning will also then kind of bleed over into the health side, getting us back into a healthier frame of mind. And so with those two things right now, that really is going to be my huge, my effort, pushing forward. And again, substance abuse, I think we can all agree where we are in this COVID era. Mental health, depression, all of those key factors have contributed to what we're seeing as far as the abuses of those substances. So I've got a lot to do, and I'm ready to do it, and looking forward to coming to some better weather. I'll be traveling out this week out to Cayuga in Tompkins County, doing one of my first little visits, kind of some meet and greets again to get out and start meeting the constituents and listening to their concerns.
Go into the small business section.
Yeah. Senator, let's talk about small business for, well, maybe more than just a moment. You're a small business owner.
Yes.
You understand the challenges that small business owners face in upstate New York. Maybe, before I ask that question though, maybe, because I know your background, I know what you've done in that county to our north. But let folks, I think that's a fascinating story. Would you let us know a little bit more about your background as
Sure.
a small business owner here in upstate New York?
Sure. So our company that I'm the CEO of, Formtech Solutions, we actually do research and development and product development for food companies. And it's really been a very interesting path, if you will, career path, in that I've drawn on my experiences, as I've said before, being 8 years old and being taught the trade from my father, who was a German sausage maker, all the way through to when I went to SUNY Delhi and graduated there with my degree in food sale and distribution, to where we are today doing the research and development and product development. So I've always been in the food line somewhere along my career, and it's an amazing process when folks come to us, and I call it mission impossible at times, Ray, because here's kind of the broad sense of what we're asked to do. So we're usually a customer will come in with a product, and it may have ingredients in there that are not as not as palatable from a sense of chemicals and preservatives and things like that, and they want us to take those out and use natural ingredients, which is what we do. But they want it to look good, be good for you, last for 90 days, and then be cheap. So, so I've always said that that's kind of like the Mission Impossible structure that we have. But we've been very fortunate, very lucky to move our corporate offices from Texas to Schenevus, New York, where we're now located. And we actually are bringing our director of technical services from the West Coast out, and he will be actually running the operations in Schenevus. And myself and my chief of staff will have the ability to focus in on the 51st 100%. So challenges are there by all means. I mean, where we are as far as business goes and small business and with COVID still being the main driver of both stresses and issues for businesses, to open up and how to open up safely, communication within this COVID area, getting the correct information out to our businesses. I hear many times from small businesses, just make up my mind for me. I mean, that's kind of the attitude that they have, coming from Albany. And I think so we're starting those steps. We're starting having legislatures come back in to legislate, to hopefully communicate through us to our constituents, to our businesses. And in light of where we are with COVID, let's see if we can't see that springtime. And I'm using springtime for more than just good weather. I'm looking for springtime to start to open up. We need to really start seriously looking at opening up. And I think we can safely.
Senator, I don't want to, as we're talking about your business, I don't want to let you get away from talking a little bit about your new agricultural endeavor. Not only are you taking food that was produced by others, but you're getting into the business of food production sort of yourself. Would you tell us a little bit about that?
Sure. Not like we didn't have enough maybe going on. We decided to start a vineyard in Schenevus, and my business partner, who's also my chief of staff, and I had some agricultural land that was not being utilized, and in our current business we do some extracting, if you will, of essences and things of that nature. So we kind of said, wouldn't it be kind of neat to see if we could put together a vineyard with the idea being along the lines of the Rieslings, that are so well done here in the Finger Lakes, region. So again, taking it as a research and development project, we did our soil analysis, we did our elevations, our latitude, longitudes, where the sun is any given time, all the things that go into it, which fits right into what we do. And we actually came up with 2 varieties of grapes that we feel are going to be able to give us a really unique semi-dry Riesling wine when we get to that point to harvest. And one of those varieties of grapes is actually a newer one that was developed out at the University of Minnesota, believe it or not. And it is a hardier grape that imparts those drier notes and those kind of what they call the clover taste, the notes to it. And so we're excited. We're 3 years away from our first harvest. But Ray, I'm going to extend an invite to you 3 years from now to come on up and enjoy hopefully some really nice semi-dry Rieslings for us. So thank you.
Anytime I get to talk about food, I'm right.
We had a great conversation that night. We did. It was.
We did. let's shift away from food for just a little bit. You mentioned about reopening, and you're right. Businesses are concerned about reopening and how we're going to reopen, and of course, everyone wants to do this quickly, but also safely. And the two ideas are not mutually exclusive. But some of the areas that business owners are still concerned about um, include things like providing some good faith liability protection. Now, that may be more of a federal issue than it is a state issue. And also helping small businesses recoup some of those COVID-19 capital costs. Do you see anything out there on the horizon that might support ways to support those small businesses going into the future?
I think you basically kind of outlined it really well, Ray, that I think this is going to be a push, if you will, or from a federal standpoint. I know in the midst of budget and where we are in Albany in the sustained chaos is the term I use when it comes to budget
Yeah.
anyway. I don't think there's the huge focus that there should be on that issue. I think there's so many other monumental budget issues that are before us that are being addressed. So with that being said, as a small business owner and as the senator here for the 51st, we are actually going to, and we have started to, I think, bring those issues to light. We wrote a letter to the governor explaining that in our area, the camps, the outdoor camps, the baseball camps, and we had a great conversation with our folks from the YMCA's and so on. And we need to know now. I mean, we need to start planning now to eventually open up in the spring. And in most everybody else's mind, you think you just turn the key and everything opens up. And so we wrote a letter to the governor saying, listen, we need to start now. We need to start this process of evaluating, setting some procedures in place, communicating those ideals, to our business and camp owners. And I'm proud to say that just yesterday, we heard that the governor has actually started, that process. So I feel as though that you can do monumental things even when you're in the minority. Simply bringing these to light in a respectful manner, in a concise manner, and hopefully a well thought out manner, we can move these issues along. And to that end, we are going to do the same thing now with our small businesses. We need to put a plan in place. We need to bring light to it. And here's the other thing, Ray, that I think sometimes gets lost. We could open up at 9 o'clock today, and I still believe you're going to have a maybe almost 2 to 3 month lag of just people getting back into the idea that I can actually go and socialize again and do these things. So even if we were to do it today, you're still looking at a lag period that businesses right now can't really afford to sustain. So we're going to push it. We're going to keep that on the forefront. Keep our governor informed of where we are, especially here in the 51st. And I look forward to it. I think this is a great opportunity to look at this as a business plan. And that's exactly what I'm going to apply to it as a
Great.
Yep.
Yeah, and you raise a really good point. You're right. I think if it's 5 of 9, if we were to open up all the stores in 5 minutes, folks are going to be very reticent about walking in, because we need to do some work to restore some public confidence in public health, and that's lowercase p, lowercase h. One of the concerns that that we have at the chamber is the equity, if you will, the equitable treatment of rural areas in New York State vis-a-vis the receiving the vaccine. It's been Delaware County and other places have been called a vaccine desert. And a little bit later on, Mandy Walsh with Public Health, Delaware County Public Health, is going to be joining us for offer an update as to what's happening, because there's been some recent changes there as well. But one of the things that we're concerned with is this inconsistent information that comes from the state, inadequate supplies, controlling what happens here from Albany, and which may work fine in an urban or even a suburban model, but it doesn't work for us out here in the rural areas. Are there things that you might be able to do there to help support getting that vaccine in people's arms, restoring that sense of confidence? Because right now, we're, especially our elderly, are fearful about even walking outside the door. And they're being told, well, if you want a vaccine, you have to go to Plattsburgh. Not a, for someone
Right.
who, for a lot of our seniors, getting from Walton to Delhi is a major logistical nightmare.
True.
So are there things that you might be able to help with in that regard?
Yeah, Ray, I absolutely believe so. And again, I'll draw on my business background. I mean, we have done basically product rollouts for many of the national chains. And it's interesting. They should have, or we should have, maybe more appropriately, really looked at it. How does a national chain, doesn't matter the name, that has units all over the U.S., get product to each and every one of them, and when they have the rollout, it's there, it's ready to go. You don't have the issues of supply, and I feel as though, and it's easy to armchair quarterback this, but I really feel like we all knew that there was going to come a time when the vaccine was ready, and how do we roll it out, and how do we get it to the Main Street level of our communities? And we fell short. We fell short with that plan. I mean, there's two philosophies in business. I can either produce it and then sell it, or I can sell it and then produce it. And unfortunately, I think we went with the second scenario, where we have sold, and opened this up, and everybody, knowing full well that everybody was going to not only need it but want it. And our supply is just intermittently at best. I mean, we never know. And you're right with exactly your analogy with Delaware, and Schoharie, for that matter, too, as being these vaccine areas of desert. I fully agree. So that being said, how do we improve it? How do we move forward? And again, I'm sitting on the health committee. I have communicated our processes of looking at what we call touches. So in our business, how many times I touch the product to get it ultimately to where it is. The number of touches usually means that there's something that could go wrong. So you want the least number of touches to move this product along. And one of the scenarios I would love is if Albany could just be concerned about procuring the product. Let's have a supply chain or a materials management concept, if you will, of bringing that down and getting that into our Department of Health and our emergency services at the county level. So I'm going to speak specifically now for the 51st. So I have 9 counties, okay, of which we have our Department of Health and potentially emergency services. So there's 18 now touches that Albany would look at, because once they get the product there, they can kind of say, we've done our job. Now it's on those 18 to get that down even further, to get it to Main Street. And being a fireman, volunteer firefighter in an EMS squad, I felt as though that the firehouses would be the great distribution point in those communities. There is basically, for lack of a better term, one in every community. Everybody knows where they are. There's a trust factor built into that I know my chief, I know my, for the elderly to come in and to do that. And so now we take those touches, and our counties now have however many, I think there's like 26 fire departments in Otsego County. So we go from that to that number for distribution. And I always felt like that was it was a good plan. It was a plan where right now I don't, the pharmacies and the hospitals are so overwhelmed with the other side of it that I really felt this was great. And just yesterday, I had a fantastic tour up at SUNY Oneonta, and they brought me through a process that they have now set up that they could be a huge distribution point for vaccines and to handle the masses. I think there was something along the lines of between 1,000 plus people a day that they could, if they had the product, they could move through relatively easy. So it's kind of what the horse has already left the barn. We're closing the barn door, but I feel as though that kind of a plan and that outlook would surely go a long way to helping us vaccinate and get it into the arms, if you will, of the most vulnerable.
Senator, it's refreshing to hear that's the first time I've heard anyone discuss the distribution from a business distribution point of view. And that's refreshing to hear that. Just want to remind everyone, if you have some questions, please put those in the chat box. Lillian's keeping an eye on that chat area. Senator, just a couple of the questions that I have. You're also on the Judiciary Committee. Our judicial system for the last several months has essentially been closed. When do you think we can expect our judicial system and our courts to reopen across New York State?
That's a great question. In instances like that, Ray, I usually go to my magic 8-ball, to look at it to see when. In light of where we are, that again brings back a sense of normalcy. To get back to, locally, I was just my mom being a former judge. I see the way that how intricate that is in the local community, and starting the foundation for security in everybody's mind. I mean, to know that we have our courts open, the judiciary doing what it is supposed to do, I think again goes a long way to starting that mental process of recovery from where we are in COVID. If it was me, I would say we should be opening up next week. We really should be, and dealing with those issues that are more local, that are generated more locally.
Ray, can I ask a quick question?
Absolutely, Todd.
Great, thanks. Good morning, Senator.
Good morning.
Thank you for joining us this morning. I just wanted to circle back quickly to a topic you discussed in the beginning, cell service, and it's a major priority of the chamber is to try to establish cell service with continuity throughout the county. Recently, we were having some discussions about how to fit some benchmarks and metrics to it, and that's something you had mentioned. Do you think that it's a reasonable goal to say that, say within 2 years, we can have cell service established throughout the main corridors of the county? Is that something that we can realistically sort of plan on? And if so, as always, how can we help? We spoke with Senator Martucci was at this same event last month, and he seems gung-ho to jump on this issue, and we want to support in any way we can. So we sort of, are trying to figure out the best approach and the best expectation that's reasonable for achieving it so that we can convey that to our members.
Todd, the first thing in any project that I've ever been on, we try to set an end date. And what does that do? It gives you the focus that I have a metric that needs to be met. And I think a lot of times we talk about it, we know the importance of it, but we don't give it, like I say, in 2 years. And absolutely, I love the idea of saying, you know what, 2 years is our goal. Let's start working towards it now. It sets, it starts the clock. It starts me thinking. It starts us all working towards. I've got 2 years now to make this happen. And that's the first part of any of our projects is when do you want us to deliver the results, of this project? And as a chair of public works here in Otsego County, I was fortunate enough to be able to get some cell service in an area of Otsego County that was not being served and had some challenges as far as even landline service goes. It takes some work. It takes getting the decision makers, which is not always easy, into the room at the same time. And if you've ever kind of gone through some mediation processes, I always loved it because they always said, okay, so at the end of this meeting, this is our desired goal, and you lay it right out there. And again, we need to work towards it. So the other issue that I think comes with cell service, and I don't know how this would play into it, is the fact that some folks don't like the idea of a cell tower, being in their town or community. So we have to kind of work. How do we work through that? Is there a way that the idea of having cell service potentially, the ability to log on and get some internet service as well versus the aesthetics of a tower. So I'm willing to do it. And how can you help? You just started it by bringing it up. I mean, you just started the process of talking to it. So we'll talk about the 2 year and how you can help, but I would like to actually sit down and put an end date in mind. And I have a friend of mine who really does a lot of these mappings, and what we have to really look at is maybe strategically where the coverages would need to be that would handle the largest populations. Of course, that's where most of the towers are, but those areas that are underserved, where would a strategic tower go that would give us that circle of cover or coverage? And I was in Andes, and I always remember, in Andes, we're at the fire department and there's like zero service. I mean, zero. And so to me, that's unacceptable. I mean, it's a safety issue as well. So we're going to work with that. Congressman Delgado and myself have spoken. We've set some other dates out there to see what funding can come potentially federally. And then being on the internet and technology side, I would promote kind of the same concept of that we did back in the 30s, rural electrification. How did we do it then? How did we get electric to all these rural areas, back in the 30s? Why can't we do cell service and broadband today? So
Senator, if I can jump in, the Delaware County Broadband Initiative between Delhi Telephone, Margarettville Telephone, and Delaware County Electric Co-op for broadband was absolutely built on that idea of rural electrification from the 30s, 40s, and 50s. One of the and Todd raises an excellent point. It's a priority for the chamber for the last couple of years. We've discussed this with Congressman Delgado on several occasions, and as Todd noted, Senator Martucci last month at this forum. One of the things that one of the parts of the infrastructure that we can help with, and I'm thrilled to hear that you're going to be tying broadband and cell phone together, because often we hear about broadband, and we have a great broadband network here in Delaware County. It's, as you discovered by being in Andes. Our cell service, well, not so much. Delaware County invested millions recently over the last few years in establishing a network of emergency communication towers.
Yep.
So those towers are in place and available to put private providers, self-providers on those towers. So it may just be a matter of coming up with that plan. If the infrastructure is already there, coming up with those incentives for providers to put them on there. So that's something that I think that the chamber and you and Congressman Delgado and Senator Martucci can, I think we got our first joint project here.
I love it. Exactly.
And maybe in the next 2 years, we really can have something. And we'll even let you make that first cell phone call from Andes.
I love it.
We do have a question regarding education. Lillian, what if you would jump in and give us that question?
Good morning, everyone.
Good morning.
We're going to have Ray mute here so I don't have feedback. Great. Good morning, Senator. Thank you for joining us at the chamber this morning. And the Delaware County Chamber is not just focused on healthy businesses, but healthy communities. And one of the things that makes a community healthy and is at the focal point of our communities are our schools. And our education system has been impacted by the pandemic like every other industry. What information can you share about the suspension of state standardized testing in our elementary and middle schools, as well as the Regents exams at higher levels? Will that suspension, if it occurs, impact funding to our schools as laid out in this year's state budget?
Yeah, that's a tangled web, as I say. Number one, you're 100% correct with Lillian, what you put out there. The schools are the heartbeat of our community, and I can speak to that personally again with Skenevis. Skenevis School has some financial challenges ahead, and it's amazing how that has also bled over, if you will, into just the community attitude, along with all the other issues that we're dealing with. That has been a huge impact on the people's psyche. I mean, not going to a Friday night basketball game, which is, I know it sounds kind of contrite, but it really does a lot to establish, seeing your other community members and things of that nature. So I agree with that. Number two, I am in full support of funding education, both at higher ed and education for our schools. Again, that starts the process of normalcy. It starts us getting back to, I don't know if we'll ever say we can get back to where we were, but it starts us on the path back to where we were. I would like to see us take the approach of using our what monies we have maybe allocated or even thought about for economic development, and really apply those funds to education. And I'm going to tell you why, because I really believe that investing in education, at both levels, at higher ed and at our school level, is probably one of the best investments right now that we could do to get I speak in ROI, return on investment. I think that's one of the best areas that we could get back our investment. Let's get our kids on their path to graduation, get our kids hopefully to the point where they can and will and want to stay here in New York. The outward migration, I was just recently put on a committee, or excuse me, on a task force to address the outward migration that we're seeing here in New York. So I'm 100% for funding. I don't like the idea at this point at the negative effect that challenging our budgets locally by not funding them fully. The other part of that is, the antiquated foundation aid formula that or concept that I'm learning about, and diving into, and again, finding those inadequacies on how that's formulated, how one school is getting X and the other, Y, and those type of things. Again, it's a huge effort to untangle some of those issues. But I am all for funding them, and we got to get that money out. That's the other thing. We've been kind of, remiss in getting the transportation funding for the COVID issues and things of that nature back. So I'm going to push for it. I'm going to say, let's look at taking, everyone always says, well, where's the money coming from? Well, in this case, I'd like to float that idea. Let's look at the money we have set up for economic development. Let's put it into our education side of things, and let's see where we get that return on investment moving forward.
Senator, I don't want to monopolize your time. How can folks connect with you and your staff?
Well, I am here in the district office, of course, in Oneonta. We have our in fact, Ray, I gotta get it only because I never call the office. And again, excuse me, I got to put on my glasses. So our office phone, our main line is, of course, 607-432-5524. My email is Oberacker, of course, Oberacker, at nysenate.gov. And look, I have got the greatest staff. My chief of staff was in this morning at like 7 a.m. and he's already going through emails, and I can't tell you, there is a plethora of them on all concerns and subject, and we go through them, and we're doing our best to answer them in a timely fashion, but we will get back on many things. And in fact, yesterday I had a great opportunity. One email came in and I had to give a call out. It was to a gentleman out in Tompkins County, and it was just simply kind of a congratulatory, saying, hey, I know you got a lot going on. I just want to say thank you and congrats. And he was a veteran. He's a interim supervisor for the town of Locke, and I just gave him a quick call, and the response that he got was amazing. He couldn't believe that I took time, and it was, hey, how you doing? Thank you for the kind words. So I think that goes a long way too. I am trying to do as much of that as I can in between Zoom meetings. This next week, I think, is going to be an interesting week in Albany. So I may have a little bit of a downtime as far as answering, but we really do I think, a great job of getting to our constituents' concerns.
Great. And Senator, thank you for joining us this morning. You're welcome to remain on the call and offer insights. I understand, though, your time is limited, and just in case you need it,
I love it. I love it, right?
According to my most important management tool, those courts are going to open very soon. So it's
Ray,
here,
I love it.
It's here in case you ever need it.
Don't underestimate the power of the magic 8-ball. Listen, I want to thank you all for taking the time to talk with me and to bring up some great issues and questions. I look forward, I really do, to with Todd and the questions he put forward. It would be a good day, like you say, Ray, when I can make that first cell phone call in Andy's. And we're going to hold to that. So I
Great.
thank everybody. Thank you.
Thank you, Senator. Yeah, and we talked a little bit before with the senator about the COVID vaccination program, and there's really is so much confusion about the program. Who's eligible? Where do you go? When can I get a shot? When am I eligible? So to bring some clarity to this whole issue, at least here in Delaware County, we've invited Mandy Walsh, the director of Delaware County Public Health, to inform us about the current process and what changes may be coming. Mandy, I'll turn everything over to you.
Sure. Thanks for inviting me. And I'm going to try to bring as much clarity as I have related to the process. So I logged in later, but I did hear the senator talk about distribution. So I'll just reiterate that the supply is a federal supply of vaccine that is then distributed to the states. The states then decide how to allocate that vaccine, and they have specific guidelines, and we have lots of criteria that we have to follow. Some of this information changes on a weekly basis. Some of it remains, and you kind of see, as the senator just discussed, the supply chain, the demand versus the supply obviously isn't matching. So every week you may see a new group of people that are eligible for vaccine. However, we don't necessarily have the supply to accommodate that. And at the county level, I don't have a lot of control over who gets what vaccine or how. That is all state allocated. So it's a little bit, it's very tricky. And in some cases, the pharmacies now are receiving the supply directly from the federal government. That's been really challenging. Some of the communication has been challenging and ever changing. So trying to get a great handle on who has what vaccine when, that's been a huge point. Health directors, we meet weekly with the state. We also have what's called these vaccine hubs. The state of New York is broken into these vaccine hub regions, which Delaware County is part of the Southern Tier Vaccination Hub. Those hubs are supposed to be responsible for sort of coordinating where vaccine is, or at least having an idea. Some of that communication has been patchy between the state and those hubs. And again, even this week, you've probably seen where with the weather, nationally, there's been a big shortage in distribution of vaccine this week related to newest allocations. And the most recent group that is eligible now for vaccine is the comorbidity group. And the governor has given counties the ability to decide how to start that allocation process and how to prioritize. So in our county right now, currently too, and in the state, you're looking at what we call the 1A category of people, and we have this huge 1B group of people, plus within that, it's broken down into the 1B essential workers, and there are a lot of stipulations as to whom can vaccinate whom. So previously, hospitals were vaccinating this 1A group of people. These are healthcare workers. These are forward-facing healthcare workers. They may be in a hospital system. They may be in a healthcare setting. They may be school nurses. They may be people in that forward-facing group. It also there's an OPWDD component, and there's an entire list, which I can resend Ray the links. It's the COVID vaccine distribution link, but I will be happy to send you all the links after that, so Ray, you can share all of this. There's also the guidance documents change on a fairly frequent basis as to allocations. So when we do receive vaccine, we're actually given direction as to which groups we can use the vaccine for, and we must stick to that group because it does impact our ability to receive vaccine in the future if we don't follow that. They're very stringent, and it's a federal and state tracking system. So we also, again, with the supply and demand, currently right now, I can tell you that in this county, we started to receive vaccine. It was the week of the 18th of January, and we vaccinated so far about 600 people. I have a second dose clinic that's actually going on right now. It's our first second dose clinic. This is a 2-dose vaccine. So now you have the added complication of first and second doses. And there's a lot of tracking behind the scenes for people that are eligible. So up until this week, health departments were really tasked with focusing on the 1B essential worker group. So that's a large group of people. And, we had a lot of issues with the state and trying to advocate because our 65 plus population is very vulnerable. It's a very large population in Delaware County. We're the top aging county in the state. And, you know, we didn't really get a lot of say into how to allocate that. We were required to focus on the 1B essential workers. Hospitals were required to focus on the 1A groups. As of this week, we are allowed to now look at comorbidities, and Delaware County is focusing on 65 plus with comorbidities. That is, it's 24% of our population in Delaware County. And we have one particular zip code, Margaretville, that actually that's 30% of the makeup of their zip code. So we also, 8% of the seniors over age 65 live in poverty. These are some of the reasons why we chose to focus sort of on the 65 plus comorbidity group first. A lot of it also has to do with the amount of vaccine that we actually have coming into our health department. We partner also with our hospitals, and this week we've been able to partner with them. We're working on, because of the fact that we're a very large geographic county, and the fact that we are a smaller populated county, we're not obviously having a mass vaccination site sitting right in this county. The mass vaccination sites are far distance to travel for that 65 plus population. I actually met with Congressman Delgado on Tuesday because I'm a huge proponent for trying to advocate for a large mass distribution site in Oneonta, because we feel that that would really benefit the minimally the 5-county area to help bring some of the vaccine closer to this area. What happens with the state allocations too is that the state vaccination sites are actually able to grab the vaccine first, and then it's then distributed out to the various other portions of these counties. So they do encompass a large amount of the vaccine that is available in New York State. And we'd like to see, you know, a larger clinic happen in our area. We also have plans, the health department, our hospitals serve as a wing and our partners so that we can further spread vaccine out. There are lots of other plans that existed prior to this federal and state distribution decision to how they were going to allocate and distribute vaccines related to push locations, pushing out to sites that actually have the ability to vaccinate their own populations. All of those plans existed prior to this this strategy, and they all still exist. The big issue that we have right now is just the limited amount of vaccine. And so right now we have actually public health, we are running clinics. We usually run 1 to 2 to 3 a week, depending on if we're doing second doses. Right now, our clinics are closed clinics. We're working off of lists because we have so many 1B essential workers. Now we're going to be focusing on the 65 plus comorbidities. So you're not seeing a live public site because we don't have enough vaccine to put that out there. By the time we have the vaccine, our clinics are booked. We literally continue to work off of lists, and it's happening, and it's not just our county. So we still continue to send people. I can tell you right now what's, you know, sort of available. So the pharmacies are doing the 65 plus population in general. That's comorbidities, not comorbidities, any of that. The big issue is because it's federally distributed, the state does not have the information to give us as to who has what vaccine or how much they have. It's getting better, but that information was sort of trickling down to our level so that we could get an idea of what was going on. And even then, it's a little bit patchy. We're scheduling to do a comorbidity clinic. We also are focusing on 1B essential workers, and I have second dose clinics going on. The shortage this week, though, is that our vaccine that would be allocated for this week has not arrived yet. So we've had to bump clinics and move things around to accommodate that. We have to, when we receive vaccine, it is over. We have a 7-day window between when it is ordered, when it's shipped, and when we have to give it out. We are required to give out all of the vaccine or at least redistribute it if necessary, which we end up usually giving all of it out in order to receive the next round of vaccine. And it's a very short time frame. Sometimes with the shipping and delay, we have 24 to 72 hours to get the information about who we're allowed to allocate the vaccine to, schedule everyone for clinics, and then do the vaccination. It's a very tight time frame, and depending on the holiday weather or any other issues coming up, it's very challenging. And you don't know what you're going to get until usually about Sunday, And even then, this week, I haven't received what we're supposed to be getting for this week for the first dose group. So that's been very challenging. And we're not the only county, in the state that's had that issue. It's been kind of a national issue with the supply chain related to the holiday and the weather.
Mandy, if we all have seniors in our lives, we all have folks who are over 65 and some below 65 with some of those comorbidities. What an awful term. How can folks, what do folks need to do in order to get that shot in the arm?
Sure. So I'm glad you asked that. So we've actually, from the get-go, this vaccine process, as some of you may have even looked at, with some of these links and scheduling, if there's various levels of computer savviness, and especially with the 65 plus population. Also, we have bandwidth issues, internet concerns. We partner with our Office for the Aging. They're actually assisting people to register. They're assisting people with finding locations. They're helping people actually register at pharmacy sites. They are helping people register for our clinics if they're 65 plus with morbidities. They are doing that. So I will send you, their phone number. They are going through. They're actually helping people actually find the location and register. That could be at a state location. That could be at a pharmacy. That could be at one of our sites. And they are, now that we are now able to have a little bit more, hopefully, allocated vaccine for that age group locally, we can try to, get more people into some of these closed clinics and work from these lists. Office for the Aging already has existing lists. And when our hospitals receive additional vaccine too, they are also focusing on comorbidities. They can fill in with some of these other categories. If you are a 1A or someone that has, feel that you've missed the opportunity, you can still utilize that. But again, all of these systems are part of that. And Office for the Aging and their actual, Lillian, the number that they're utilizing too is 832-5750. I just wanted to correct that.
Okay, Lillian's making that change in the chat box, and we'll be sure to include all that information that you're going to send us in next week's newsletter. So everyone, please keep an eye on that. And
just one more thing I will mention too, and we're hoping, again, we've been told that more is coming. We're hoping it is, because we want to see people get vaccinated, and we want to be able to do more. We have the ability to do some push pod locations, but we need more vaccine in order to kind of roll that out.
Yeah,
so,
Mandy, it sounds, you when you came on the call, and I appreciate you coming on. I know you had an earlier meeting this morning. What I was discussing with the senator was this idea of a vaccine desert, that our rural areas are not being treated equitably across New York State, and that's a huge issue. And based on what you said, we're kind of getting the leftovers, if you will, from the state sites. So hopefully there's some avenue that the county government, county public health, I know you're in a more tenuous position, and the chamber can work together to advocate for increased levels of vaccine supplies coming to our rural areas, because it's a real concern. Folks are afraid to go out, and I know the emphasis has been on promoting. Like the senator said, you can either produce then sell, or you can sell and then produce. And he thinks we've sold and we've sold well, but now we need to produce and get those in people's arms. So thank you for joining us this morning. This won't be the last time that we're going to have you on, and even just for a quick update every so often to keep our employers informed as to what's happening. It's 9:35 now. I want to hold to our commitment that we are done in about an hour. We're just a little bit over that right now. I want to thank everyone for joining us this morning. We're going to see you next month, and at next month's Chamber Connects program, we connect with our congressional representative, Antonio Delgado. So that's going to be an interesting conversation with the congressman. Remember, at the Delaware County Chamber of Commerce, we are stronger together. See you all next month.